Hi, I'm Dr. Steve Weiner from the Aesthetic Clinique in Santa Rosa Beach, Florida. And what I'm discussing now is the use of Sculptra. Sculptra has been FDA approved for about 8 years now, and cosmetic use of Sculptra for about the last 4 or 5 years. We've been using it at the Aesthetic Clinique for over a year now. And Sculptra is used as a dermal filler, but it's very unique. It's not used as the other dermal fillers are. It's used to volumize the entire face. So when you inject with Sculptra, you're injecting the entire face, the temples, the cheeks, the jawline, the areas around the upper nose. You don't use it to inject lips or the nasolabials or around the eyes that much. And let me digress a little bit, because as the face ages, you lose both muscle, fat, and bone. And to replace that, you need to use volume. And the way that plastic surgeons used to think is that as the face aged, the skin sagged, and you would tighten it with a facelift. Well, as you know, you saw a lot of these people that looked like skeletons, but with tight skin. And it wasn't until maybe the last 5 to 10 years that we realized that part of aging isn't just the lax skin, but probably mostly due to loss of volume. So Sculptra is a naturally occurring sugar that breaks down into carbon dioxide and water when it's broken down by the body. So it's a natural substance. And it's given over a period of about 3 to 4 sessions, each session taking approximately 20 to 30 minutes. About 24, 48 hours later, your face looks the same as before you injected it. That's because the water and the lidocaine are absorbed. But then over the next 6 weeks, your body gradually reacts to the Sculptra, and it creates collagen. So your body is creating a natural improvement to your body with its own collagen. That's why the results of Sculptra last several years, 2, 3 years, maybe even longer. You need to touch up Sculptra maybe a year to 2, and that's mainly because you're aging and you're losing more fat and bone and muscle. But it's your collagen that you create usually lasts for approximately 7 years or longer. So it's a very long-acting filler. And it's very economic when you think of the duration of action and the amount of areas you inject. So as I want to reiterate, the areas that we typically inject are the temples, the area in front of the ear, which actually loses a lot of fat, particularly in people that have had prior facelifts. The jawline, particularly the back part of the jaw, is lost as you age. And then the front part of the jaw as well as the chin area. What you can see in these before and afters is a significant improvement in the loss that you have seen in the temple areas, as well as the upper cheeks, and a much firmer jawline. Each one demonstrates a different degree of improvement, because everyone's going to react a little bit differently to the Sculptra as far as collagen production. One other thing I want to mention is that this is an excellent procedure to do coincidentally with the Ulthera, because they both improve the collagen. The Sculptra at a little bit different level, at the little deeper level, and the Ulthera would be a little more superficial. So that's going to tighten the skin and produce collagen, and the Sculptra is going to produce volume. So those go hand in hand, and there's studies that show that if you do Ulthera with Sculptra, you get even better results than doing each one separately.